Is behavioral variant FTD a type of frontotemporal dementia? Imagine a condition that changes a person's personality and social behavior before memory loss even becomes noticeable. That's what happens in behavioral variant frontotemporal dementia, or BVD. Yes, BVD is actually the most common form of frontotemporal dementia. Frontotemporal dementia is a group of brain disorders caused by progressive damage to the frontal and temporal lobes of the brain. These areas are key for controlling behavior, personality, language, and emotions. When these parts are affected, it leads to distinct symptoms that set BVD apart from other types of dementia. To understand better, think of frontotemporal dementia as a family of disorders. Among them, BVD is the most prevalent. Other variants include language-related forms like semantic variant primary progressive aphasia. Sometimes, older terminology called it Pick's disease, but now we recognize it as part of the frontotemporal dementia spectrum. The hallmark signs of BVD include noticeable personality and social behavior changes. People might become disinhibited, acting inappropriately in social settings, or show a lack of motivation called apathy. They may also lose empathy, become compulsive, or make poor judgments. These symptoms happen because BVD affects brain regions responsible for social understanding, emotions, and decision-making. Unlike Alzheimer's disease, memory loss is usually not an early feature of BVD. Instead, individuals often struggle with planning, organizing, and controlling impulses. They might behave inappropriately, lose insight into their condition, or develop unusual eating habits. The typical age of onset is between 45 and 65, but it can occur earlier or later depending on the individual. Diagnosing BVD involves clinical assessments of behavioral and cognitive changes, often supported by brain imaging and neuropsychological tests. As the disease progresses, social skills and executive functions decline further, leading to increasing challenges in daily life. Understanding that BVD is a subtype of frontotemporal dementia helps us see that dementia isn't just one disease. It's a spectrum of disorders with different symptoms and progression patterns. Recognizing the behavioral signs early is important for diagnosis and management. Since these symptoms differ from the memory-focused issues seen in Alzheimer's, tailored care strategies are essential. Managing BVD often involves supporting behavioral symptoms and helping maintain social functioning for as long as possible. In summary, yes, behavioral variant frontotemporal dementia is a specific form of frontotemporal dementia. It is characterized mainly by early and prominent changes in personality and behavior rather than memory loss. This reflects the particular brain regions affected in this condition. If you or someone you know shows signs of significant behavioral changes, it's important to consult a healthcare professional for proper evaluation. Remember, each person's experience with dementia can be different, and personalized medical advice is always the best course of action.